Swollen cheeks, causes and treatment. Cheeks can swell for several reasons, from minor facial injuries to infections or serious underlying health issues. This swelling can occur in one or both cheeks and inside the mouth. In this video, we explore the causes of swollen cheeks and how doctors treat them. Areas of swelling. The area of swelling can help a doctor identify the problem. For example, an infection may cause swelling in only one cheek. Find more examples of causes of swelling according to the affected area. One cheek. Conditions that may lead to swelling in one cheek include a facial injury, a tooth abscess, salivary stones, an infection such as cellulitis, a salivary gland tumor. Inside the cheek, swelling on the inner lining of the cheek may indicate lymphadenitis, the enlargement of a lymph node usually due to infection, a tooth abscess, hypothyroidism, Cushing's syndrome, Sjogren's syndrome. Alongside swollen gums, cheek and gum swelling often indicates an infection of the gums or a tooth abscess. Pericoronitis, for example, is an infection that occurs around a tooth that has only partially broken through the gums, and it can lead to cheek swelling. Causes of cheek swelling. A wide range of issues can cause swelling in one or both cheeks, and some of these causes are more serious than others. For example, injury. An injury from a fall or blunt force, for example, can damage soft tissue and bones in the face, which can result in facial swelling and pain. Minor injuries often heal on their own, but anyone who suspects that an injury may be more severe should receive medical attention. Tooth abscess. Tooth decay is a common oral health condition that happens when acids break down the enamel coating of a tooth. Untreated decay can lead to infection around the root of the tooth. If the infection becomes more severe, a pocket of pus called an abscess may form, leading to swelling. Mumps. Mumps is a contagious viral infection of the salivary glands. Symptoms including swelling in the jaw and cheeks may appear 12 to 25 days after the initial infection. Other symptoms of mumps include a headache, a fever, fatigue, muscle aches or chills, a loss of appetite. Salivary stones. Salivary stones are calcium deposits that form in the salivary glands. Another name for this issue is cellulitis. Salivary stones most commonly affect people aged 30 to 60 and are more common in males. The exact cause of salivary stones remains unknown. However, they can form when bacteria and food particles enter the salivary glands. If a person does not receive treatment, a salivary stone can block a salivary duct and lead to an infection of an infected salivary gland. Can include swelling in one cheek, which may feel warm, sensitivity or pain in the area, difficulty or pain when chewing or speaking, foul tasting discharge from the infected gland, a fever. Lymphadenitis. Lymphadenitis occurs when one or more lymph nodes swell in response to an infection in the area. If the infection is in the head or neck, it may lead to swelling in one or both cheeks. Cellulitis. Cellulitis is a bacterial infection in the fat or soft tissue beneath the skin. Alongside facial swelling, other symptoms include skin that feels warm, pain or tenderness in the area, a fever, chills. Pericoronitis. Pericoronitis is an inflammation of the gums around a tooth that has only partially emerged. Third molars or wisdom teeth are most commonly affected. Pericoronitis can sometimes cause intense pain. Hypothyroidism. Hypothyroidism refers to the thyroid gland not producing enough hormones to meet the body's demands. Weight gain and puffiness in the face are common symptoms of hypothyroidism. Other symptoms include fatigue, muscle and joint pain, sensitivity to cold temperatures, reduced sweating, heavy or irregular menstrual periods, constipation, a slow heart rate. Cushing's syndrome. Cushing's syndrome occurs when the adrenal glands produce too much cortisol. People with Cushing's syndrome may experience weight gain and puffiness in the face. Other symptoms include increased fat in or near the base of the neck, a fatty mass or hump between the shoulders, purple stretch marks on the abdomen, breasts, hips and underarms, muscle or bone weakness. Sjogren's syndrome. Sjogren's syndrome is a chronic autoimmune condition in which white blood cells attack the salivary and tear glands. People with Sjogren's syndrome may develop swollen salivary glands which can make their cheeks appear puffy or swollen. Other symptoms of Sjogren's syndrome include excessive dryness of the mouth and nose, a chronic cough, vaginal dryness, dry, itchy or burning eyes, numbness or tingling in the hands and feet, fatigue, blurry vision, difficulty swallowing or speaking. Treatments. A doctor may prescribe or recommend various treatments to reduce cheek swelling and address the underlying cause. Medication, surgery or both may be necessary in some cases. Minor injury. When swelling in a cheek results from a minor injury, it may help to apply a cold compress to relieve swelling and pain. Keep the head elevated to stimulate blood flow and reduce swelling. Gently massage the cheeks to stimulate blood flow. However, if an injury seems more severe, it is best to receive professional care. Lymphadenitis. In a small 2019 review, researchers found that antibiotic treatment was effective when lymphadenitis resulted from bacterial infection. In this research, Microbacterium avium and Microbacterium intracellular are the species responsible. However, antibiotic resistance can cause difficulties. A 2015 retrospective review found that when Staphylococcus aureus bacteria are responsible and resistant to antibiotics, surgery was sometimes required. Cellulitis and pericoronitis. Antibiotics tend to clear cellulitis and pericoronitis if the inflammation results from a bacterial infection. But if the bacteria are resistant to antibiotics, surgery may be necessary. Tooth abscess. A dentist or oral surgeon can treat a tooth abscess by surgically draining it and rinsing the area with saline water. They may also prescribe antibiotics. Mumps. As with many other viral infections, no specific treatment exists for mumps. However, people can manage symptoms with rest, fluids and over-the-counter medications. Vaccination is the most effective way of lowering the risk of mumps The mumps vaccine comes in 2 doses and is available for children 1 to 12 years old. Salivary stones. The right treatment depends on the size and number of stones. Over-the-counter anti-inflammatory drugs can help reduce swelling and pain, and a doctor may try to free the stone by massaging the affected salivary gland. If an infection develops, the doctor will likely prescribe antibiotics. If one or more stones are large, they may require surgical removal. Hypothyroidism. There is no cure for hypothyroidism, but doctors tend to prescribe synthetic hormones to account for the lack. The doses will depend on several factors, including current hormone levels. Cushing's syndrome. Cushing's syndrome responds to medications that lower cortisol production in the adrenal glands or decrease adrenocorticotropic hormone production in the pituitary gland. Sjogren's syndrome. A range of medications and lifestyle changes can help manage symptoms of Sjogren's syndrome, depending on the combination of symptoms and their severity. For example, corticosteroids may help reduce inflammation and swelling. Oral cancer. Treatment for oral cancer varies depending on the type, location, and stage of the tumor. Doctors can surgically remove tumors and affected lymph nodes. Radiation therapy and chemotherapy can help treat advanced forms that have spread to other areas. Cheek swelling in children. In a child, cheek swelling may result from lymphadenitis, cellulitis, Cushing's syndrome, hypothyroidism, facial injury. When to see a doctor. A person should receive immediate medical attention if sudden cheek swelling accompanies swelling of the face, lips or tongue, a skin rash, hives, difficulty breathing or swallowing, dizziness. Prevention. In some cases, cheek swelling results from poor dental hygiene, which can lead to an infection. It is crucial to brush the teeth twice a day and follow all other dental hygiene recommendations. If an infection seems to be healing slowly, it is important to consult the doctor or dentist. The sooner the person receives care, the better.